Dr. Fatunde, a mom who has a child, girl, boy, when should that mom, at what age of the child should that mom send the child to an orthodontist to make sure that the teeth are aligned, getting aligned, that the treatment starts, the orthodontic treatment, if needed at all, starts at the proper time, or maybe even things can be done that orthodontic treatment is not as severe or maybe not at all happening. When should that happen?
The American Association of Orthodontics recommends that every child from age 7 should get an orthodontic evaluation once a year.
Age 7?
Why is this necessary?
Age 7?
Age 7.
And do you agree with the American Orthodontic Association? Do you agree with them?
I definitely do.
Okay.
At age 7, that's right about the time when the first set of permanent teeth start coming in. You have the molars. The first molars come in, and that establishes the backbite. Then you begin to see the anterior teeth in the front get replaced. The baby teeth are shed off and the adult teeth come in, and as the upper and lower come together, that establishes the anterior bite. So that's a very good time for a child to come in for an orthodontic evaluation. It's most of the time is just an observation to ensure that those teeth are coming in the way that they should. If they are not, then sometimes we may have to do what we call interceptive treatment. And again, just as the word says, it is simply to intercept something going wrong and to correct it early enough. We have cases whereby a simple interceptive treatment has actually not only put the teeth in the correct position, but actually prevented much severe problems with the jaws.
Okay.
There are also a few cases, even before age 7, I had to do interceptive treatment in a child that was just 5 years old because the upper jaw was limited. The lower jaw somehow trapped the upper in, that upper jaw would simply not be able to grow as well as it would have if it remained trapped. And simply by untrapping that upper jaw, the child grew normally, and by the time that the child was about 10, 12, the child really did not need any major orthodontic treatment. If we did not intercept at that time, that certainly will have been a case for surgery. So, age 7, every child is recommended to come in for an orthodontic evaluation. However, if mom notices other things like trapping of the jaw, even before age 7, please bring them in. Also, bringing the children in allows us to monitor the growth of the occlusion. They come in, nothing is wrong, we reevaluate them in another year, and we continue to do that until almost the complement of the adult teeth are there, and then we evaluate if they need braces. They need braces, we go on. They don't need braces, that's fine. When they come in earlier, at some point interceptive treatment is needed, it's done. Usually it's just a limited set of teeth or an appliance that we use, and then once we're done, then we'll simply put them back on the monitoring system. A lot of the time, is teaching time will help to save a whole lot more and will help to limit much severe problems of growth of the jaw or even alignment of the teeth.
Wow, okay. So basically, you're making sure that the teeth are getting grown the way they are. If not, you can slightly adjust it before. Maybe you can pull a tooth or do something where a tooth was missing just to make sure that the permanent teeth grow as straight as possible in the first place. Make the way clear for them. And that starts around age 7, sometimes even a little earlier. And doing that can avoid maybe the wearing of braces totally, maybe, or at least makes the orthodontic bill less severe. And it's not just about the bill, because it's after all the teenager who does have to wear those things for a couple of years. And no matter how beautiful they are these days, and gorgeous and invisible and flags on it, most I would assume, I never had braces, and we probably would assume to rather go without it. And I'm sure mommy would also rather go to Disneyland with the family rather than forking out the money for the orthodontic bill, if possible. That's basically what you're saying.
Yes.
Thank you very much.